Hi, I'm Dee, and I will be sharing information regarding Bell's palsy and the roles of physical therapy in treating Bell's palsy, as well as abolishing misconceptions. There were a lot of misconceptions on the causes of Bell's palsy that has been circulating on the social media, like consuming milk teas, eating fast food, and sleeping while the hair is still wet. And because of the false information being spread, the online community knows one of the symptoms of Bell's palsy, which is drooping on one side of the face. Now, what is Bell's palsy? Bell's palsy is a condition that causes weakness on one side of the face. This is because the facial nerve is inflamed. Now, what is the facial nerve? The facial nerve is the seventh cranial nerve for all of you who are keeping track out there. This is responsible for the movement of the forehead, the eyelid, the cheek, and the mouth, as well as the place of the front two-thirds of your tongue. When that nerve becomes damaged or swollen, this can lead to Bell's palsy. Now, because the nerve becomes damaged or swollen, that person might have reduced or absent movement on one side of the face with difficulty closing the eyes and decreasing taste. To be clear, there is no specific causes that have been conclusively established, though we are not certain that the causes of the nerve inflammation. There is still evidence to suggest that there is likely to be linked with viral infections like herpes simplex and varicella zoster. What can happen when the facial nerve swells up? Well, when the facial nerve swells up, the bony canal, also known as the stylomastoid foramen, that the facial nerve went out cannot accommodate its sizes anymore, thus this will lead to blocking on the neural blood supply. For medical management, corticosteroids and antiviral medications are generally considered to be the first in line to treat Bell's palsy. Many studies do not demonstrate any advantage of using antiviral medication combined with corticosteroids over corticosteroids alone. What about the causes of Bell's palsy? Bell's palsy symptoms include drooling, mild weakness to total paralysis of one side of your face occurs within hours or days, facial drop and difficulty making facial expressions such as closing your eyes and smiling, changes in various amounts of tears and saliva produced, headache, a loss of taste, pain around the jaw or in behind your ear on the affected side, increased sensitivity to sounds on the affected side. For physiotherapy interventions, we have neuromuscular retraining or NMR. We can also do manual massage. So the difference between manual massage and NMR is that manual massage is a technique performed on the muscles on the face to regain facial animation and balance, while NMR neuromuscular retraining are exercises to retain your body to use its muscles more effectively and efficiently. And then we have another one, which is the EMG or electromyography and mirror biofeedback. This is for neuromuscular education, while the patient will maintain the timing and symmetry of the face using the mirror. We also have TESS or tropical electrical stimulation. This is a treatment aimed at restoring the function of the muscles of the face through mimicking the stimulation provided from the normal nerve functioning. And then we have proprioceptive neuromuscular facilitation techniques or facial PNF exercises in Bell's palsy. This is a manual resistance technique that works by stimulating fundamental patterns of movement through stimulation of proprioceptors resulting in either facilitation or inhibition. That's all. Thank you.